and people pleasing, trauma, or even stigma. These are all things that can come out of bad mental health. Some people don't realize how important mental health can be. Mental health is just as important as your physical health. Your mental health determines whether you want to push yourself to be better or just sit there and do nothing. Many different symptoms can come from having bad mental health. The one I'll be covering today is depression. I know probably all of you think you know what this is. First, let us start with the symptoms. The symptoms break down into 5 categories: mood, sleep, whole body, behavioral, and cognitive. The most common is thoughts of death or suicide. Most people start to feel unworthy of their life. People will start to feel guilty for no reason. Loss of sleep may become a habit, or even oversleeping. Some people may even start a habit of overeating or not wanting to eat at all. Either one of these may cause the person to have less energy. They'll have trouble making decisions for themselves that people with depression wouldn't have trouble with that. People will lose interest in everyday activities that they used to enjoy, such as being with family and friends, going for a ride on their bike. For someone to be considered to have depression, they must be feeling most of the symptoms for at least 2 weeks. When a person has depression, they can also start to have psychosis symptoms. This is when a person starts to have hallucinations or delusions, such as imagining that they see things, thinking that they hear voices. Bipolar disorder is also in the depression category. This is a manic type of depression. This just means you may or may not be able to control your emotions. It's as if your emotions change up a flip of a switch. One little thing could set off your whole mood and make you angry. One little thing could make you upset. When people already have an illness and they also suffer from depression, it can make the illness even worse than it already is. Symptoms may vary for the different ages of people who have suffered from depression, such as little kids throwing tantrums and not wanting to go to school. But elderlies may suffer from when they already have diseases, and it makes it worse for them. Even more women have been diagnosed with depression than men. A lot of men don't actually admit to having depression. Now, let's get into how you can actually treat depression. A lot of people don't know that there's treatment out there for this, but there's lots of ways you can get help. The first and most common way is therapy. Therapy is a place where you can go and just release all your emotions and cry and get angry, whatever you need to do. Therapy is always confidential, which is the best thing possible for somebody with depression. Therapy is a very effective way to treat depression because you're not being judged. It's just a free zone for you and yourself. Another way to treat depression is with medication. There are 4 different medications that you can take. The first one is SSRIs, which are made to ease your symptoms. There are also antidepressants, which are supposed to relieve your anxiety. Another one is anxiolytic. These are used to relieve anxiety and tension and sometimes help you sleep better. The last one is antipsychotic. These are used to reduce the symptoms of psychiatric conditions. The last one is a medical procedure. The medical procedure for depression is called electroconvulsive therapy. This therapy works by sending electric currents to your brain. These electric currents create a seizure, also known as a shock treatment. The shock treatment works to your brain to talk to the nerves so that your mind kind of wants its feeling to change. And lastly, let's talk about the causes of depression. The first and most common is childhood trauma, or the experiences that you had when you were younger. Trauma is definitely one of the biggest factors for depression. Physical health can even impact your mental health. I know earlier I said they're just as important, and they are as important to each other, but both of these go off of each other. If your mental health isn't thriving, then your physical health most likely isn't. And if your physical health is thriving, well, maybe your mental health isn't. Drugs and alcohol have a very big impact also. These take control of your mind. They make you have hallucinations. I've seen it firsthand. It can make depression so much worse than it should be. This is one of the worst combinations you will ever see. Depression may also just run in your family. Your grandma had it, to your mom, to you. The last one is grief. Grief is definitely one of the biggest actually factor of depression. You lost a loved one, a family member, or a close friend, and it hurts a lot, and you don't know what to do with yourself sometimes. You just want to sit there, or you just want to cry. Sometimes you can't even cry because you have so much pain. Grief is one of the biggest things to deal with, and it makes depression pop up in an instant. And it's not a good thing, but it happens to almost everybody. So, wrapping up, because I want you guys to take into consideration everything I've said. Starting off with depression can take a toll on almost everything in your life. The way you eat, the way you sleep, the way you think, every aspect. Also, most people don't think that there is a way out, but you can seek help. It's there. There's many different treatments, and it's okay to ask for help. Also, depression has so many factors and causes. It's not just one thing that starts it, and there's not just one thing that comes out of it. And depression is the most common outcome out of bad mental health. And it's when you feel sad, upset, lonely, guilty, when you feel like you are always in pain and no one is around you, when you have no one to support you. And remember that mental health is just as important as your physical health. One is not greater than the other. They are both equal. That's what depression is. Thank you.